Hi, I'm Kristen Pelletier, founder of KP Consulting. I've spent the last 20 years in dentistry helping dentists to reduce stress, increase profitability, and create a practice they love. I often see offices struggle with restorative cases falling through the cracks. Just think about it. How many patients leave your office with a treatment plan and say, "Let me check my schedule and I'll get back to you"? Most offices that I work with have some form of continuing care system in place to keep their patients active in hygiene. What I don't see very often is a structured system to keep patients with restorative needs active in the practice. Putting a follow-up system in place to track those patients is a critical part of improving your case acceptance process. When I first ask dental teams about how they follow up with patients who have unscheduled treatment needs, I'll hear something like, "When we're slow, we print a list of patients who have unscheduled treatment, and we call as many people on the list as we can in the time available." Or, "We make a sticky note to remind us to follow up with the patient." This is a haphazard approach that is going to produce haphazard results. Let's face it, when a patient leaves your office, life happens. Your treatment recommendations can become a distant memory. They may not even think about their necessary treatment until they make their next hygiene appointment. What you need is a solid system to make sure they remember not only your recommendations, but also the risks to not getting treatment. And I'm not talking about a sticky note system. Instead, you need a systematic approach to following up with patients to ensure that they'll follow through on getting the treatment they need, just like you do with your hygiene continuing care. This is especially important for patients with restorative procedures that require multiple steps, like a root canal, because we all know that there are risks to not taking that restorative process through to completion. In order to communicate effectively, I recommend that you use a combination of written and verbal communication to keep your treatment recommendations top of mind until the case is completed. I've found that practices that use a structured delayed treatment system will have higher case acceptance and healthier patients.